Yes, welcome guys to another episode, right? Yes. So in this episode, I'm going to do a video about the timing of oral contraceptives post delivery, right? That is post delivery, or maybe post miscarriage, or maybe post abortion, right? Yes. So when should you start using oral contraceptive? Let's say, for example, you had an abortion, right? Or you had a miscarriage, or maybe you have given birth, right? You are asking yourself, when should I start using oral contraceptives, right? So basically, that's what I'm going to talk about. So let's start. If you're not subscribed, just take 1 second to just click the subscription button, right? Just take 1 minute, right? Yes. So let's continue interacting in the comment section, right? Hope you learn. So let's say, for example, you are having you had miscarriage, right? Or you had a spontaneous abortion, right? Or you had an induced abortion. That is in the first trimester, right? So you should start using oral contraceptives immediately, right? Yes. So if you had miscarriage, or a spontaneous abortion, or an induced abortion during the first trimester, right? You should consider if you're planning to use family planning pills, that is the oral contraceptive pills. You should start using the oral contraceptive pills immediately, right? Yes. If you have an abortion or a miscarriage, let's say from 12 weeks to 28 weeks of pregnancy, that is during the second trimester, right? You should consider if maybe you're planning to use the oral contraceptive pills, you should consider using them within 1 week post these incidences, right? Yes. So within 1 week, you should consider starting oral contraceptive pills, right? That is if you have a plan to use family planning, that is the combined oral contraceptives or the progestin only pills, right? So within 1 week, that is post abortion maybe, right? Or maybe post miscarriage, that is from the 12th week of pregnancy to the 28th week of pregnancy, right? That is if you're planning to use oral contraceptive pills within 1 week. If you don't have any risk of if there are no other risk factors of DVT, right? The deep vein thrombosis, right? Consider starting using it within 1 week. That is from week 12. If you lose your pregnancy from the 12th week to the 28th week of pregnancy. Yes. What happens if you give birth after 20? That is from 28 weeks onwards, right? Maybe you've given birth to a preterm infant, that is from 28 weeks, or maybe your pregnancy has reached term, that is from 36 weeks onwards, or maybe you had an abortion during that period from 28 weeks onward. When should you start using oral contraceptives? So if you had an abortion after this period, right, or miscarriage after this period, after 28 weeks of pregnancy, or given birth to a preterm, or maybe a term infant, right? If you're not breastfeeding, right? If you're not breastfeeding, you will consider using oral contraceptive after 3 weeks, right? That is if you're not breastfeeding. If you lost your pregnancy, right, or you had a miscarriage, right, you should consider using oral contraceptives from after 3 weeks, right? What about if you are breastfeeding? If you are exclusively breastfeeding, right? That is breastfeeding on demand. You should consider starting to use your oral contraceptives for 2 days. That is after 6 weeks, right? So why are we saying after 42 days or after 6 weeks? Immediately after giving birth, right? Your chances of blood clotting is very, very high, right? So again, if you consume estrogen, if you ingest estrogen, again you are increasing the chances of blood clotting, right? And again, this hormones, this estrogen and progesterone, there is treated in breast milk, right? So during breastfeeding, the newborn can feed on them, right? And this waste product, these hormones can have different effects on the newborn, right? So again, you should you should consider using oral contraceptive after 6 weeks. That is a minimum if you are exclusively breastfeeding. Yeah, that is breastfeeding on demand. Again, in about 98% of women, right? About 98% of women who are exclusively breastfeeding, right? That those who are breastfeeding, let's say day and night, right? Uh, and they can go for up to 6 months without receiving their menses, right? They can go up to 6 months without receiving their menses. During this period, they cannot get pregnant, right? They cannot get pregnant during this period if they have not received their menses. So during these 6 months, she cannot get pregnant, even if contraceptives are not been used, right? Yes. So during these 6 months, they're using what we call lactation and amenorrhea method of family planning, right? But again, you should consider using family planning after 3 months, right? Yes. So during these 6 months, if you have not received your menses, you are not going to get pregnant, right? But again, you are advised to use family planning after 3 months, right? Yes. So I've seen that if you lose your pregnancy during the first trimester, maybe due to abortion, maybe due to miscarriage, right? Consider using, if you're planning to use pills, that is oral contraceptive pills, consider using them immediately after losing the pregnancy or after the miscarriage. If you have lost, if you have lost your pregnancy, if you have lost your pregnancy after the 12th week to the 28th week of pregnancy, maybe due to miscarriage or maybe due to any other reason, consider using, if you're planning to use oral contraceptive, consider using it within 1 week, right? That is if there are no other risk factors of having different thrombosis, what we call DVT, right? And if you have lost your pregnancy post 28 weeks of pregnancy, right? Maybe you've given birth to a baby, maybe yeah, you have just lost your pregnancy. Consider using it within, say, after 3 weeks. That is if you're not breastfeeding. If you're breastfeeding, wait for at least 6 weeks, right, to start using the pills because of the reasons you mentioned, because of this increased chances of blood clotting, and again, these hormones are excreted in milk. So the newborn will feel that their hormones, they have different effects on the newborn, right? Yes. And again, post delivery, if you're exclusively breastfeeding, you can go up to 6 months, right, without getting your menses. During this period, even if you have not used any contraception, you are not going to get pregnant, right? But again, you are advised to use if you are planning to use the contraceptive pills, you are advised to begin as early as 3 months, right? Yes. So that marks the end of our video. That marks the end of our video today. I hope you learned the time when you should start the oral contraceptive pills, that is post delivery, that is post abortion, that is post miscarriage, right? Yes. So I hope you learned something. Continue commenting, continue sharing your ideas, right? Yes. So just take one moment to subscribe, just 1 minute to subscribe. Yes. More content is coming, more information is coming. I hope you are enjoying it. Let's meet in the next video.